Hi, I'm Lindsey Schneider, and thank you for joining me for my thesis defense, The Effects of Peak Equivalence and Transformation Treatment on Derived Relational Responding as a Generalized Operant and IQ. Behavior analysis is rooted in data to drive the analysis and treatment for individuals with ASD. To date, there's not been a review of any empirical data to support the current ABA protocols that we use with individuals with ASD, such as the VB-MAP or ABLE, skills, and ESDM. ESDM is normally taught in a naturalistic environment. There's no studies to date on the reliability and validity of this protocol that we use, but there has been studies done that show an increase in IQ and adaptive behavior, and that was done in 2010 by Dawson. And so the need for empirically validated interventions for individuals with ASD is high, as the number of individuals that are being diagnosed in recent years has gone up. So research suggests that ABA used for individuals with ASD can have major impacts on intelligence, social skills, daily living skills, and language. So it's important to give individuals with ASD an effective treatment. So then there's PEAK, which is promoting the emergence of advanced knowledge relational training system, which is aimed at promoting complex language. It's broken down into 4 modules: direct training, generalization, equivalence, and transformation. The first 2 modules are based strictly on verbal behavior framework that was developed by Skinner. And then the last 2 modules are focused on the complexity of human language and cognition. So the final 2 PEAK modules, they focus on stimulus equivalence and relational frame theory, which expands on the limitations that were first brought into play by Skinner's verbal behavior. So Skinner's definition of verbal behavior has been criticized for being too broad and not functional. And so stimulus equivalence and RFT. The emergence of untaught stimulus relations following the history of reinforcement for relating trained stimuli. Sidman's work was viewed as a critical tool for the analysis of basic language, and the research that he did gave momentum for the development of educational criteria based on stimulus equivalence. And then RFT is a modern behavior analytic approach to the study of human language and cognition. It came from as a result of the previous work done on stimulus equivalence, and it expands on the ideas of stimulus equivalence, such as comparison, opposition, hierarchy, difference, and perspective taking. And so some past research that's been done on stimulus equivalence and RFT has been proven it can expedite learning. We know that human language and cognition is learned through patterns of derived relations, so an intervention focusing on these things for an individual with ASD would be really beneficial. So stimulus equivalence and RFT, they expedite learning by teaching skills directly to an individual, and then therefore they derive more relations. Skinner argued that verbal behavior was learned, but a study done in 2019 by Dixon and his colleagues, Derived Relational Responding, suggests that humans can learn language and cognitive skills through untaught relations. So stimulus equivalence and RFT research. Some past research on stimulus equivalence and RFT in 2019, where adolescent boys with ASD were taught to mand using arbitrary stimuli by teaching the boys to match A to B and then B to C. In 2012, children with ASD demonstrated the ability to derive intraverbal responding to categorical classes following a category tagged and matched to sample procedure. In 2014, they used a SPOT procedure to teach auditory and visual stimuli, and then tested for tacting and listener responding. And then the stimulus pairing observation procedure paired with multiple exemplar training was shown to be effective in that study. And then also in 2019, Raymaker and his colleagues did a citation analysis where they found that RFT within research was increasing. And then PEAK research. So PEAK is grounded in traditional ABA, but differs from the traditional ABA that we're used to in the past in its application of RFT to promote efficient learning. So Belisle in 2016 he did a study where they demonstrated perspective taking skills in children with ASD using the Peak T treatment. Stanley in 2018 used the Peak E module to teach chemical compounds, unit conversion, and historical figures. Participants acquired mastery of these skills and demonstrated the emergence of untrained relations. In 2018, Dixon and his colleagues, the results for this study indicated that there was a strong correlation between participants' scores on the pre-assessment of the Peak E and IQ. And then some more Peak research. So there have been studies done to support the reliability and validity of Peak. Dixon in 2014, studies to support reliability have been conducted on the direct training module. Peak has high validity to the Peabody Picture Vocab test, the IQ, and the one-word expressive and receptive test. These assessments are often used with individuals with intellectual or developmental disabilities, so that's a good comparison between the two. And then Peak compared to the VB MAP, which is often used with individuals with ASD, the study done on this suggested that there's a ceiling effect for the VB MAP. So when an individual scores a 138 on the VB MAP, that there would be a ceiling effect for that. So that's suggesting that the first two modules of Peak cover all of the VB MAP. So then we have the second two modules of Peak that bring the learning much further than the VB MAP would. So Peak uses environmental variables to promote learning and language acquisition. Current ABA programs lack data and demonstrate that to demonstrate that they're valid and reliable to be using with individuals with ASD. The purpose of this current study was that we examined how Peak E and Peak T treatment affects an individual's derived relational responding and their intelligence scores. The design we used in this study was a multiple baseline with an embedded probe. So this design allowed for continued examination of the efficacy of Peak to see if skill acquisition could occur due to mastery of earlier learning skills and to look at the increase in performance due to treatment. We also evaluated the instructional procedures designed to teach the language and cognitive skills to individuals. Now on to the method section for this study. Our participant was Abby, a 4-year-old girl who was diagnosed with autism. She, at the time of the study, was on a wait list to receive ABA services at a clinic in Springfield. She received a flyer from the clinic about the study, and that's when she contacted the researchers and then came to Missouri State for her initial assessment. So during her initial assessment, it was conducted at Missouri State in the research lab. It was approximately 2 hours long, and then during this initial assessment, the researchers completed the Peak E and the Peak T assessments, the IQ assessment, and the deceleration coefficient assessment. And the IQ assessment we used for her was the WIPSI because she was 4 years old. And then while she was getting all of these assessments done in the research lab with the researchers, there was also a researcher out with the parent while the parent completed a packet that included a consent form, a QABF, and then it also had indirect assessments for the direct training and the generalization modules. And it's worth noting that there were no behaviors seen during the initial assessment, but the parents did report that they had compliance issues in the QABF. So for her indirect assessments, the direct training module is up there. It's the green one on the top. These were indirect assessments completed by the parent. So per the parent's report, Abby received a 146 out of 184, and she did score above age norm. She mastered all but 2 of the foundational learning skills, all of the perceptual learning skills, and most of verbal comprehension. And then for the generalization module, which is the red one on the bottom, according to Mom's indirect assessment, 123 out of 184 skills were mastered, and she also scored above age norm on this test too. She mastered majority of foundational learning targets, verbal comprehension, and memory skills. She was selected for this study based on her scores from the Peak E and the Peak T assessments done initially. She demonstrated reflexivity but lacked symmetrical relations, and then she also had emerging skills in the transformation module. And her intake IQ, like I said earlier, we used the WIPSI due to her age, and then the subtests that were included in the WIPSI were matrix reasoning, picture memory, and information. So during the initial assessment, her IQ raw scores for information were 20, for matrix reasoning were 12, and picture memory were 6. And you can see that in the top chart on the left. And then her scores for Peak E were 12, and then her score for Peak T was 30. So during treatment, it's also worth noting that we did see frequent challenging behaviors with this participant, and some of those that we saw were elopement from the room, property destruction, such as throwing materials or toys, aggression towards staff. She would hit with toys or with her hands or feet, and then we also saw noncompliance during work tasks. And so there were a few procedural changes that were implemented throughout treatment. Differential reinforcement, a token economy was established and then reestablished. Timers were used to keep the session on track and to make sure that all researchers they were using the same time, the same amount of work, the same amount of reinforcement. A wall divider was used to lower elopement. Staff attention was removed during non-compliant behaviors. And then we also introduced AIM, Accept, Identify, Move, towards the end of treatment to help her promote emotional and social development for our participant. The entirety of the study was conducted at Missouri State University in the Park Central office building on the second floor. The sessions were 2 times a week, approximately 2 hours each, so a total of 4 hours a week of treatment. The treatment room was attached to an observational room where the guardians could watch during the session. The treatment room was approximately 10 foot by 8 foot. It included toys, a table for the participant and the researcher, and then there was an iPad mounted above the table so that we could live stream into the observational room or record if needed for IOA and fidelity data. We used Zoom to record the sessions. The treatment room consisted of a child-sized table and chairs, a chair for the researcher to sit in, and a wall divider. Various toys were in the treatment room, such as pop-up toys or musical toys, and we also had a car track and cars. We had an iPad mini that was available for reinforcement if the participant wanted, and we also had edibles. Our participant in particular typically brought her own toys that she would bring to the session that she wanted to work for that day. And then in the room, there was also therapy materials such as the Peak E and Peak T stimulus books, data sheets needed to run that session, program stimuli, so cards or objects at time, and then we also used a timer and a token board. So more settings and materials. The treatment was conducted over 10 weeks, 2 sessions a week, 4 hours total a week. Each session had approximately 1 to 3 researchers per participant. So we had one that was directly implementing programming, one that was normally taking IOA data, or another one that was with the parent, or sometimes we had one that was helping with behaviors. So the researchers that were involved in the study were trained graduates for the ABA program at Missouri State, and at times were assisted by undergrads. But everybody had to pass 100% fidelity before being able to implement programming for the study. The material used for the initial and final assessments were original copies from the Peak stimulus book. The IQ material for the initial and final IQ assessments were also original copies from the WIPSI manual. IQ probe material was made by the researcher and was made to be equivalent in complexity to the original set of stimuli. We did not use the same set of material for probes that we did for our initial and final assessment to limit exposure to the participant. The deceleration coefficient was a researcher-made assessment that was ran on a Microsoft Surface. It used colors, pictures, and arbitrary words to test relations. Probes were a different set of stimuli, equivalent in complexity to the initial and final assessment. And then programming used throughout the 10 weeks was researcher-made, made it on Publisher, and was similar to the typical stimuli that was described on the program sheet. So the dependent variables, the assessment scores for Peak E and Peak T modules were recorded. Mastered programs were recorded for both Peak E and Peak T. The relational deceleration coefficient was a method used to test the participants' relational responding. So that included a spot training procedure, matched a sample in a test phase. The intelligence test, the WIPSI was used. We used the information, matrix reasoning, and picture memory subtest for those, and that was probed 4 times throughout the study. Skill progress was monitored throughout the duration of this study. Total percent correct was calculated for each trial block that was implemented. Inter-observer agreement and fidelity data was taken on the data recorded for each trial block. IOA was collected using a video feed or direct observation. At times, 2 researchers would be taking data at the same time, or a researcher would be watching via Zoom after the session. IOA was comparing scores between observers and making sure that the data being taken was correct, because that directly affects the study and the progress of skills. IOA was taken on 26% of trial blocks and averaged 92%. And then our fidelity data was used. We used the Peak Relational Training System Fidelity Checklist that was 2-part. It had a preparation checklist and an implementation checklist. So the preparation checklist looked at, was the researcher able to identify appropriate stimuli as reinforcers, program sheets with appropriate stimuli, did they date and randomize the stimuli, and did they minimize distractions in the environment? And then they were rated on that. And then the other part was the implementation checklist, which did they clearly present the SD? Did they allow appropriate time to respond? Did they provide reinforcement or prompts when appropriate? And so our overall preparation fidelity was 96, and our overall implementation fidelity was 94. Procedure, the initial assessment completed at Missouri State University at the PCOB. They completed the Peak E and the Peak T assessments, and just the receptive test was done for Peak T. They also did the IQ assessment and the deceleration coefficient assessment. No challenging behaviors were exhibited during the initial assessment, but like I said earlier, the QABF that the parents filled out reported non-compliance as an issue that they typically see, and according to the QABF, the results indicate that attention and tangible could potentially be a function for this behavior. The researchers that completed the initial assessment also completed a challenging behavior index at the end of the assessment. This indicated that she scored a 1 out of 20 for frequency and a 1 out of 20 for intensity, which was fairly low, implying that there was no behaviors during the initial assessment that impeded with the actual assessment being conducted. And then treatment began after the initial assessment was completed. So the design. The study was conducted over 10 weeks using a multiple baseline design across skills with an embedded probe. So this was a combination of multiple baseline and a probe design. So the initial baseline test of performance, each program was tested 2 times. The first baseline was the initial test, and then the second baseline was to test if they mastered due to other programs or maturation. So if targets are being mastered out during baseline, more complex skills would be put in their place. And then once skills are mastered, you conduct the first baseline for another program. So it's like a stepwise progression of baseline testing throughout your entire study. So 4 programs going at once was what our study was. 2 from the E module and 2 from the T module. So there was 4 at once. Both modules trained and tested concurrently, allowing for replication across modules. And then mastery criteria was 3 train blocks over 90%, followed by a test block over 90%. And our probes. So our IQ probes were implemented every third mastered skill or every 3 weeks, whichever came first. And so during these IQ probes, the staff would read verbatim from the WIPSI booklet until the discontinue criteria was met. And that was 3 consecutive scores of 0 for both information, matrix reasoning, and picture memory subtest. And then for the deceleration coefficient probes, these were implemented at the same time as the IQ probes, the same day, the same session. And the assessment was ran on a Microsoft Surface. And all we did was do what was the total score correct out of the total correct. So the researchers had to progress through the slides until the discontinue criteria was met, which was if they didn't receive 100% on the training block or the test phase, they would go back to training up to 3 times and then discontinue the assessment if the participant wasn't getting them correct. So the peak E module, the equivalence, assesses the learner's ability to demonstrate arbitrary relations. So we have reflexivity, symmetry, transitivity, and equivalence. So this estimates the learner's pre-existing relational repertoire, and this is 184 skills directly linked to the Peak E curriculum, which is a criterion reference list. And then Peak T module, so the transformation module, only the receptive test was done for this research study. So promoting the understanding of relations among stimuli is the goal. So the different frame families are right there. There's 6 of them. And then this module also has 4 different levels of complexity, 1 through 4. And peak programming was based on the direct assessments that were conducted during the initial assessment. So during the multiple probe design, the first baseline is the direct test. And then once the program is mastered, a second baseline is completed. So if the skills mastered earlier, we're looking at if the skills mastered earlier are prompting mastery of skills later. The assessment material was provided to the researcher, such as the script, the scoring guide, and the series of cards for the assessments. And so we use performance matrix to visually organize the results of the assessments, and it was a really easy way to select programming. These are the participants' performance matrix for the E and the T module. The E is on top and then the T is on the bottom. So the units that are not highlighted on the matrix were up for grabs for programming. And so you would just look at the performance matrix and implement the corresponding curriculum. And so we use preference assessments during the sessions with the participant. Most of the time, we would just ask her what she wanted to work for that session, and she was able to answer. She always brought toys from home that she wanted to work for that day, so that's how we used preference assessments with her. We used a discrete training trial procedure during our sessions where we had high-quality instruction and feedback during our training trials. And then our training component, we directly trained to test for derived relations. We present the SD, allow 3 seconds to respond, prompt if needed, and reinforce the learner. And then during our testing phases, present the SD, allow for 3 seconds to respond, score yes or no based on the learner's response, and then no reinforcement or prompts are used during this time. And then these were the data sheets that we used for recording. They have 10 trial blocks. It's a mass trial block used to train and test relations. You randomize the order of the classes to reduce rote memorization with the learner. You help determine mastery for the learner. Like I said earlier, it was 3 trial blocks over 90 and then a test over 90. And these data sheets were really easy to use. They help you over here with your response scoring and lay everything out just like it's supposed to be. So Abby's initial scores for the equivalence module were 12. She mastered out of reflexivity during the initial test, as she was able to demonstrate identical matching pictures, identical matching words, and identical matching objects. This suggested to us that our targets should begin in the frame family of symmetry, so training A to B and testing for derived relations of B to A. Abby's initial scores in the transformation module were 30 for the receptive test, all of which were from level 1. This suggested that her targets should begin in level 2 of coordination and comparison because she had emerging skills in other frame families that we could build on in the future. So during the 10 weeks of treatment, she mastered 9 programs from both Peak E and Peak T. 6 skills were from the frame family of symmetry, 2 were from coordination, and 1 was from comparison. And so this graph shows her results. These were the first 4 skills that were implemented for Abby. Baseline percentages were typically low, and then when treatment kicked in, you can see where the percentage correct was much higher than it was in baseline. So for coordination 7E, the different markers symbolize the difference between train and test blocks. We had some challenging behaviors during this target. As you can probably notice, it was a little all over the place. But if you notice the phase change line, that's when we started kicking in the behavior plans and the differential reinforcement. And then you can see the top 2 targets were pretty, the baseline was pretty low, and then when we kicked in treatment, and then we got a test to get over 90% fairly quickly. This graph shows programs 5 through 8 that were implemented for Abby. She mastered 2 symmetry programs at baseline, and then symmetry 5A. Her baseline scores were between 50 and 60%, but once we kicked in treatment, her scores greatly increased, and this was the program that we taught her to match pictures to textual words. And then this graph shows that another symmetry program was mastered at baseline, and then the remaining 4 graphs were programs that were still in treatment when we ended the study. You can see in these graphs that she was taking much longer to master these programs. And then the phase change lines, there's the first dotted line that goes down all of the graphs. That was the differential reinforcement that was implemented. And then the solid black line towards the end of the graphs is when we kicked in the full-blown behavior plan. So you can kind of see the difference between the skill acquisition between those two. And then once again, the different markers symbolizes the difference between training blocks and testing blocks. So for our trial blocks, mastered programming for Peak E, she mastered programs about every 4 trial blocks, and then for Peak T, she mastered about every 6 trial blocks. And then programs that were in progress when we had to end the study, for Peak E, she was averaging about 12 trial blocks, and then Peak T, she was averaging about 9 trial blocks. The difference between these two, I think, could be due to a few things. It could be due to challenging behaviors that we were starting to see during treatment, and it could also be due to the fact that the programs were getting more difficult for her, and so we started to see the trial blocks get a little longer, and she wasn't mastering at baseline anymore. So for our final assessment that we did, Abby's final scores for Peak, she got an 8 on Peak E, and she did not master any of the frame families, and then she actually got a 51 on Peak T receptive, which was an increase of 22% from the initial assessment. So she had improvements in majority of all the frame families for Peak T, which I thought was pretty impressive. And then, so the relations that were taught for symmetry, we had that she mastered 10 relations, but she would derive 10 more relations. For coordination 7G, she mastered 8 relations and derived 12 more relations. Coordination 7E and 7J, she derived 8 relations. And I think that this is really important to think about how much information she was able to learn that we didn't directly teach. So for example, symmetry 5A, the participant matched pictures to words, textual words. And she was able to derive matching textual words to pictures, which is really impressive because she wasn't able to read according to her parents. So this little graph or this little table over here shows you all of the training relations that were taught and as well as the testing relations. And it's just really important to remember that our participant learned a lot more than we directly taught. And then our results for our IQ. IQ scores had improvements throughout the 10 weeks of treatment. So our subtest scores were converted to full-scale IQ scores using the conversion table for the WIPSI manual. So we had a conversion score, standard full score, IQ score of 94 for the initial and then 108 for the final. Improvements in the IQs could be due to improvements that we saw in peak E and peak T, and also learning problem-solving skills and complex language. So our results for the deceleration coefficient, which tested the accuracy of the participants' relational responding using the SPOT procedure, matched the sample in a test phase. So during the initial assessment, our participant got 4 correct. She was only able to match B1 to A1, but not B2 to A2. So during our first probe, she got 10 correct, which was an improvement. She was able to match B1 to A1, B2 to B3, and A2 to A3, but she was not able to match B1 to C1. During the second probe, she got 12 correct, so she's increasing. She was able to match B1 to A1, B2 to B3, A2 to A3, and she had improvements in B1 to C1, but she didn't master that. And then our final assessment, we were unable to complete it due to time restraints in the session. And then COVID-19, we weren't able to reschedule her session. And then challenging behaviors that we saw. So challenging behaviors were seen approximately midway through the 10 weeks. We saw elopement from the child size table where we were doing our peak programming. She would at times leave the room entirely. We saw aggression towards researchers, property destruction, and noncompliance. So when this happened, some of us filled out QABFs, and then a differential reinforcement procedure was implemented where attention was not given during non-compliant behaviors and positive attention was given during compliant behaviors. And then about a week later, a behavior plan was written because her behaviors were becoming more aggressive in nature, and a token economy was reestablished where she would receive a token and that would symbolize 30 seconds of reinforcement. She had an owl token board where she would fill up the token board with 10 owls for 5 minutes of reinforcement. The treatment room, we used the wall divider, so she was not able to elope at all. Items were removed that she could throw that would be dangerous. Every 2 minutes of challenging behaviors, a researcher would leave the room. And then once she was compliant, she was required to clean up the room before we moved on to anything else. And then every 2 minutes of compliance, a researcher would re-enter the room. And the reason that we would leave the room and come back was because according to our QABF, we thought her attention was mostly her behavior was mostly attention maintained. So we decided to obviously work with that. And then we also started putting in the AIM programming into her sessions. About an hour into her sessions, because that's when we normally saw the behaviors start to increase, was about an hour into her session. So we started implementing AIM protocols. And so this would include like a discussion and an activity to promote social and emotional development with our participant. The current study indicates that by teaching through RFT and stimulus equivalence, a learner will learn skills faster, progress through a curriculum at a more rapid pace, and expand their repertoire to different forms of complex language. So the current study would also suggest that there is a strong relationship between IQ and peak. Past research done by Dixon in 2018 suggested that there was a relationship between the peak pre-assessment and IQ. Intelligence and derived relational responding may be related, and it also said that individuals with a repertoire to derive relations had a higher standard IQ score. So the current study would also expand on those results. It also expands prior research done by Dixon in 2019, where they looked at skill acquisition and IQ scores for different groups. The research used traditional ABA comprehensive groups and a waitlist control group. They had a mean score of 12.88 increase on their IQ. And the current study would expand their results because we had an increase in 14 points in just 10 weeks. So skill acquisition and IQ gains are possible in a short amount of time and with smaller doses of ABA using the peak curriculum. And the current study also extends research done in 2015 by McKee, where IQ gains were seen after only 1 month of intervention. It also extends research done in 2004 where they suggested using both Skinnerian and RFT accounts of language in an intervention by using DTT and multiple exemplar training did show results, positive results. So PEAK uses a positive reinforcement, prompting procedures, exposures to more stimuli to promote derived relational responding in a learner. Multiple exemplar training is used to promote the emergence of derived relations. And then prior research done in 2004 suggested that through the use of all of these things, improvements in derived relations were seen. Behavior analysis treatment is often embedded with an intensive intervention, so 30 hours a week. The study indicates that major improvements can be seen in skill acquisition, IQ, and derived relations in a short amount of time. Past research also suggests a high variability in the interventions that we're using with individuals with ASD, such as treatment format and curriculums being taught. PEAK is a viable option, being in that it takes into account the Skinnerian view for verbal behavior and expanding human complex language. Limitations of this study would include only having one participant. Including more participants in the study would increase the confidence that the results did not happen by chance. Another limitation would be that our participant was exposed 2 times for the probes to obtain the deceleration coefficient. This could have potentially influenced the results that we saw. The method to obtain the deceleration coefficient was changed after the initial assessment due to a floor effect, and the final deceleration coefficient was not able to be conducted due to time restraints, and then COVID-19 limited us and shut down our clinic, and we were unable to reschedule a session. And challenging behaviors that were seen during treatment, which at times interfered with our programming, we were still able to see IQ gains and skill acquisition, which is really impressive. Future research. So continue to explore the relationship between individuals with ASD, derived relational responding, IQ, and PEAK. Include a larger pool of participants, expand the criteria to include neurotypical kids, children with challenging behaviors, other disabilities, different ages, possibly a control group. Another idea would be to include parents and teachers as PEAK implementers so that those sessions that we did miss could be made up at home or at school. And then another avenue for future research would be to include a follow-up phase after treatment to see if our results generalize to a different setting, or in 2-3 months, we're still seeing the IQ gains and the derived relational responding that we were seeing during treatment. So it's our ethical duty to ensure that individuals with ASD are receiving effective treatment, and that we improve the deficits in the complex language and cognition that we see with our individuals with ASD. The study and many other past researchers would suggest that relational responding clearly plays a critical role in treatment for individuals with ASD. If you have any comments or questions, please comment them below and I will respond as soon as possible. Thank you so much for being a part of my committee and helping me through this entire process.